All right, very well. Welcome to OMHRC's Preconception Peers Program webinar, Advancing Preconception Health in Communities, launching the first National Consumer Preconception Health Resource and Campaign. Thank you very much for joining us today. If you are a PPE webinar regular, you will have noticed by now that I am definitely not Teddy Owusu. Mr. Owusu regrets that he could not join us today. Now, a bit of housekeeping before we get on our way. The audience will be muted throughout the presentation. Please submit all of your questions via the chat box. You will see it on your panel. It will say questions on it. Please type all of your questions there, and I will be checking them as we go along so I can gather them and then hold a question and answer session at the end. To answer the most common question we usually get right here and now, yes, the webinar is being recorded, and it will be made available within 24 hours of its end time. So around 3 p.m. Eastern tomorrow, you should get a follow-up email with a link to the recording. Now on to the main event. Our speakers today are Sarah Verviest and Suzanne Woodward. Dr. Verviest is a clinical associate professor at the University of North Carolina School of Social Work and the executive director of the Center for Maternal and Infant Health in the UNC School of Medicine. She is also the CDC senior consultant for the National Music playing. Suzanne? Oh, I'm so sorry. Dr. Verviest is also a CDC senior consultant for the National Preconception Health and Healthcare Initiative and the director of the Every Woman Southeast Coalition, a regional preconception health initiative. Ms. Woodward is the communications manager at the National Preconception Health and Healthcare Initiative and has extensive experience in communications and digital marketing. With her work with Makovsky, Icon Health and Fitness, and True Blue Communications. I will now turn it over to our speakers, Dr. Verviest and Mrs. Woodward.
Hello, thank you so much for joining. Hopefully
All right, so a quick question. Can everybody hear Ms. Woodward, if you would speak again?
Hello. Can you hear me?
Can everyone hear our speaker?
It says I'm muted by the organizer when I hover.
And when I unmute you, some music starts playing? Oh, yes, they're saying they can hear you. Okay.
Okay. All right. Well, let's go.
Okay, good.
We are ready. All right. Well, welcome to Advancing Preconception Health in U.S. Communities. Thank you so much, Maria, for the warm introduction. Just some quick, thank you. The quick agenda. We're going to go through about the National Preconception Health and Healthcare Initiative. We'll discuss Show Your Love, it's the first and only, and it's the upcoming launch of the new resource and social media campaign. Share some of our engagement strategies for consumers as well as PPEs, so everyone on the call, and then kind of go through our invitation to join the Show Your Love Ambassador Program. And at the end, we'll have a question and answer section. But one thing I really want to know is I think for the success of this campaign, there's a chat box. Please use it. We're going to be monitoring it throughout the webinar. And any questions you have, please feel free to interrupt with in the chat box with questions. We'd love to address them as they come in. So really the purpose of this is to share how PCHHC strategized and planned this national initiative, this first consumer-focused preconception health campaign. Another thing I wanted to note is that is to live tweet today. If everything about Show Your Love is meant to be social. So you'll see on the screen the social media properties. On Twitter, it's at SYL_today. And the hashtag, the campaign hashtag you can follow is Show Your Love Today. There's also a Facebook page, facebook.com/showyourlovetoday. The Preconception Health and Healthcare Initiative, so all the national work groups also have a social media presence, and that's at PCHHC. There's also a LinkedIn group, and feel free to join that. I believe it's a closed group, so I will go ahead and after this call look to see, if anyone's asked to join. Sarah Verbeest is also on social media. She'll be tweeting some of the content. It's at @S_Verbeest. And you can connect with her on LinkedIn, and I am Suzanne Woodward at Susie K. And again, connect with us on LinkedIn. The National Preconception Health and Healthcare Initiative. The vision is that all women and men of reproductive age will achieve optimal health and wellness, fostering a healthy life course for them and any children they may have. So what is it? It's a national public-private partnership of over 70 organizations working to advance preconception health and reproductive life planning. You can find more information about PCHHC on beforeandbeyond.org/about-us. The Preconception Health and Healthcare Initiative, there's 5 different work groups. Each has their own stream and focus. So you can kind of see an overview of the spring priorities that each work group was working on. There's the consumer work group, clinical work group, public health work group, policy and finance work group, surveillance and data work group, and then there's a leadership team. So probably the most active this spring, the consumer work group, we're launching our Show Your Love campaign. The clinical work group, they just recently released preconception care measures, and I can send the link in the chat box so that you can see, you can read about what the clinical work group's doing to establish and standardize care. So not only are we we're trying to reach consumers with this preconception health messages, we're also really focused on reaching healthcare providers. The public health just recently published a Catalyzing Reproductive Health and Justice Movement paper. Policy and Finance is putting together a policy action network in DC. The Surveillance and Data launching a national population indicators for preconception health. And really exciting, in 2017, so February 2nd and 3rd, we'll be in Tampa, Florida for the National Preconception Health and Healthcare Initiative Conference, where we're really hoping to move the needle on preconception health and really bust silos. So just another quick overview of PCHHC resources. The Before and Beyond, it's really focused on, if you go to beforeandbeyond.org, really focused on healthcare providers. It's a resource and training. That's where you'll find a lot of the about and the partnership information. And this Show Your Love, just so that it's very clear, the Show Your Love is the National Preconception Health Consumer Focused website. So there's 2 websites that are housed under PCHHC. One's very focused on health provider, on PCHHC clinical information, and one is focused more on are focused on the consumer resource. Sorry, I'm getting a chat that we're not seeing the slides in full screen. Let me check. Is everyone able to see the full screen slides? All right, so I'm gonna keep going. I hope everyone is able to see the slides. I think that it was mixed up on the screen. So when we're putting this plan together, one thing that we really thought about doing is, we're reaching healthcare professionals. We're trying to reach consumers. This is really supposed to be a multifaceted approach, reaching all these different audiences. But what do we want each audience to do? We want to equip clinicians, healthcare providers, nurse practitioners, payers, pharmacists, anyone on the healthcare professional side, equip them with the resources they need to really provide standardized good care for the consumers. We want to engage with third-party advocacy organizations, community organizations, policy and government, educational institutions, media and reporters. Wanting to engage them in all the work that we're doing, and we really want to empower consumers, whether you're planning to become pregnant or not, whether you're male, female, whatever your situation may be, that we're really engaging you in our campaign and in your own preconception care. And across the board for all of these different groups, we really want to educate and enable them to really take an active role in healthcare and either providing optimal healthcare or taking an active role in managing your healthcare. Our objective, one, for PCHHC was to raise the profile. So, picking PCHHC spokespeople on our leadership team, we have some of the brightest minds in the industry, so really elevating their research, elevating their expertise, and picking different media topics for them. So we're proactively and reactively speaking with media, getting them media opportunities, creating a social presence so that we're able to join these conversations online, asking that these spokespersons follow along with us on social media and continue to get involved in the campaign, to lead a tweet chat and keep with key thought leaders, and really to improve our search engine optimization, our digital footprint. So when you're Googling, certain resources, that our resources will come up, and by doing that, that's really constantly staying in the news, staying on top of our social media, refreshing our website with new content, things like that. And this is just a fun slide of so far. We launched PCHHC in the news in 2016, and this is where PCHHC leaders have been featured to date. It's been really exciting to see the different relationships built with different media outlets and to see them talk on different topics and really get their voice in these conversations. And now really to focus in on, beyond what we're doing with PCHHC as a national initiative, what we're doing for the consumer-focused approach. How are we reaching these consumers in their communities? How are we engaging with them? What are our strategies to help involve them in this campaign? A little background on Show Your Love. It launched in 2013 on Valentine's Day. It was an initiative from the CDC and PCHHC, a partnership. And it was designed to improve the health of young women, that's a typo, young women, to promote optimal preconception health and reproductive life planning. Since then, the campaign has really tried to expand and diversify to help young adults find resources to lead a healthy lifestyle and achieve their goals. So beyond just preconception, just reproductive life planning, helping them achieve their goals is what this Phase 2 Show Your Love launch is about. The audience is age 18 to 44. Whether you're planning to become pregnant or not, again, male, female, it doesn't matter. We're trying to reach all young adults and their caregivers, their significant others, to really help them achieve the goals that they have set out for themselves and have optimal health before pregnancy and to start thinking about those things. Some of the challenges that we've seen, the word preconception. This is a question I'd like to ask out to the chat group. So as I'm looking at the chat, feel free to tell me your experience about when you're in your communities, when you're working with different groups, what challenges you found, maybe what solutions you found. We found that the word preconception a lot of times is tied to women, to pregnancy, and it's a tough word because it is holistic health. What is preconception health? What is preconception wellness? It really is exercising, eating healthy, taking care of yourself, managing any conditions you have. There's many different messages. Not all of them are relevant to everyone. If you're really not planning to become pregnant, then perhaps hearing so many messages about folic acid preventing birth defects isn't going to resonate one example. There's also many different audiences. So how do we tailor our messages and our outreach strategy to many different groups? Another issue, especially in the United States, where more than half of pregnancies are unplanned, that perhaps the young adult that wasn't planning on becoming pregnant was not listening to maybe the folic acid, the importance of folic acid, didn't plan to become pregnant but unintentionally or mistimed their pregnancy. And planning itself is not something everyone's able to do. So it's something that we do have to consider with different audiences. The messages have not been tested a lot, and there's been a lot of issues around the annual wellness visit. Access to care has been a huge issue. What to expect, the content around it, having a toolkit to know what's the importance of it, what's the point of going, what you should expect from your doctor, what your doctor should be asking, things that you should maybe be telling your doctor proactively, and that there were limited resources. In the chat box, I'd love to see if you've noticed any of these challenges in your experience as well. So I'll go ahead and keep looking. Feel free to type if you've found solutions or if you're noticing in your work some similar pain points. One thing that we found, again, with a pain point is not only what is preconception health, framing preconception health, but framing preconception health in the media. So it's some two case studies we've seen recently, the Zika virus outbreak. We saw that, of course, it was very focused on women and what women need to be doing, abstaining from intercourse, avoid getting pregnant. Of course, because this outbreak, it's very scary for a pregnant woman, but just seeing how it was framed in the media. The CDC recommendations on alcohol were recently released, advising women to stop drinking if they're trying to become pregnant or recommend birth control. We saw a ton of backlash on that, on the paternalistic take. These are just some of the headlines we saw as we were tracking the conversations from consumers about just feeling that women are not just a uterus, and this, that you can't just tell, this can't just be focused on women, and that the Zika virus really is becoming a reproductive justice issue. There's again some really interesting headlines that we saw as we were tracking the coverage. And really, it's interesting if you go on social media to see the backlash from consumers. I'm sure that even on your personal Facebooks, I saw a lot especially from the CDC alcohol guidelines, of colleagues and peers just having a lot of comments about how it was framed. This is quite a lot of words. I'm going to quickly walk through it, but it's really it's an overview of the objective strategies and tactics that we have to have a successful campaign rollout. The priority objectives we really had for Show Your Love is to unify the national initiative, the Preconception Health and Healthcare Initiative, with Show Your Love and Before and Beyond. So really making sure that that this brand all kind of goes together. The PCHHC, Show Your Love, Before and Beyond, whether we're reaching healthcare professionals or consumers, that the sites are really, there's a step through to each of the different elements. That we raise the profile in national conversations, whether it's traditional media, like I said, or social media, getting in those conversations when there is an announcement. I know the CDC did create a graphic for men on alcohol guidelines and what they can be doing to make sure that we're in those conversations, that we're sharing, and especially our leaders are sharing their expertise and their research. And if we see a consumer speaking about needing another resource, that we're able to provide for them, that we're able to track the conversations going on and insert resources as needed. To diversify the Show Your Love program, or the Show Your Love materials, and to engage with consumers and communities. So those were our priority objectives. I'm going to walk through some of the tactics. So diversifying messages and materials. We partnered with 14 organizations across the country. They had mini grants to help us diversify our outreach strategy, our materials, and our messaging. We're hoping to develop a master messaging document for the campaign and really categorize how we can specifically outreach with different audiences, and that beyond consumers, whether that's government, nonprofit, educational, reporters, consumers, healthcare professionals, researchers, to really diversify, to have specific outreach strategies for each audience. Specifically for this diversification grant program, it's for different audiences, whether it's Latinas or African American or men, for example, to be able to, how we reach them and the message we're reaching them with will need to be different. So we're working with those 14 organizations across the country, and here's a few. You can see the organizations. You can see we tried to have some geographic diversity so that whether it's national, on a local level, each organization has some really interesting strategies about how one, their involvement with their community, because they had, each of them had a really great track record with engaging with their target audience, and then their strategy being tailored to how they can best resonate with that target audience. This is a sneak peek of some of the materials we've already seen from some of our grantees, whether it's and one thing that I think is really interesting is how they're reaching them differently, whether it's a school event. They have a step and repeat that's branded with Show Your Love in their school. They had some creative slogans that they had at different school events, focus groups, whether they're showing, for example, one is targeted to men, and they were showing men some of the original Show Your Love materials and asking them to kind of critique it, what resonates with you, what works, what doesn't. We've had two organizations. One's working with texting, so the two organizations went mobile. One's really reaching their audience via texting and social media, and that's how they're really being able to send messages and test how well it resonates. Another one is through an app that they're creating, and to help reach some of those audiences. And then other ways such as bus ads, coloring books at clinics, different toolkits, things like that. So this is just kind of a fun sneak peek of what the different organizations have already come out with. They'll continue to be diversifying these messages, testing the messages, and we're on an ongoing process. We're working with them and getting content in almost every day. So hopefully, within the next few months, we'll be able to really create a more robust multimedia library. We'll be able to really expand our messaging and our materials online and on social media, and for all our campaign materials. The objective, and this is really some of the focus of this webinar, to engage and activate consumers. So what components are needed to engage the consumer? Objective 1, to build a consumer website. So we have this Show Your Love Today website. If you go to it right now, it's not currently live, or it's not currently built out all the way. It's a placeholder. You can go to it and you can see what's a kind of teaser for what's to come. Today I'm going to walk through our beta site, so you will be the first eyes on what each of the sections are, the different clinical sections, how we built this site to really engage consumers. It's an all-encompassing site. It has healthcare information that's pretty holistic. You'll notice that the preconception language is pretty toned down, and it's more about showing love to yourself, holistic health, general health information. There's information a lot about Show Your Love and the Show Your Love program. It's really synced with before and beyond and content for healthcare professionals, because ideally if you're with a clinician and he's on the before and beyond website, that there's a step through to Show Your Love Today, and he can refer his any patients he has to this website. The objectives of the site to really activate consumers: 1, to show your love by sharing realistic health goals and tips. So everything you'll see when I walk through this beta site, everything you'll see is really easy to share. Social media links, everything hovers, it bounces. It's one-click, snackable information that's really easy to share and to get involved. 2, to learn about wellness, not just women wellness, wellness in general, preconception health, life planning, financial planning. Why is it so important to, start living healthy and modifying behaviors today? To become a trustworthy resource for men and women ages 18 to 44 about broad aspects of, physical health, mental health, emotional health, again, financial health, to really help them reach their goals, because the goals of Share Your Love today is to enable consumers to reach the goals they have and to have a family by choice and not by chance. The 3rd, to talk to your healthcare provider about your overall health, including your reproductive goals, and to know what to expect before, during, and after a doctor's visit. Some feedback we've really gotten especially is about the access to care, what to do. For example, if you want birth control or some contraceptive, you don't have access to a doctor. What other options do you have? How can you navigate, especially with ACA and insurance, how can you navigate the system? It can be kind of confusing, especially if you're a young adult and you're just trying to figure out how you can get insured, how you can access care. Some really comprehensive information is on there. The 4th is to join the campaign. So getting involved on social media as a volunteer, as an ambassador, for either as a partner and for organizations to donate if they'd like to the campaign. And now I'm going to walk through the beta site. Pretty exciting. We just actually saw it ourselves yesterday from our web developer. But I'll walk through some different elements about how we built this site to be really engaging and to become a community for people online, a platform to share and to really engage with each other. Right. And I hope everyone's able to see this. Is everyone able to see? You can see the website now. Let's see. So you'll see when you first come to the website, there's a scrolling banner about the future, some quick messages about simple steps to health and happiness, how to talk to your doctor and why. This goes to the wellness visit. Some tips to stay healthy and be healthy, and everything is very easily shareable. When you scroll down, every week we'll have wellness tips about different things, whether it's over-the-counter contraception, cigarettes, HPV shots, exercise. If you hover, there's a Facebook or Twitter, because when you click it, you can easily share this image and this fact online. Some recent news. Again, this will be updated pretty frequently. If you hover, it's easy to share. It goes, it pre-drafts the tweet or the Facebook post for you, so you just need to click over it. And then I'll go into the knowledge section, because this section's pretty fun. This is really our information hub of holistic health. So when you go to this section, there's different components about, really ideal, optimal preconception health. Whether it's having a happy and safe relationship, exercising, protecting against STIs, stop smoking, learning about your family history. So first you get little snackable information. When you click on the site, it brings you to the inner page with more robust information about, for example, about having good mental health, finding balance, easing stress, learning about your history, money matters. Each of these flip cards have an inner page where you can find some of the best resources out there about getting the care you need. The wellness section. So what is a well visit? Really hoping to make it really clear about what's the importance of a well visit, how you can access it, what to expect. So we broke it down by men versus women. When you click on it, you'll see, some resources. These are checklists about what you should ask your doctor, what your doctor should ask you. Down the road, we would love to have our own toolkit on this site where you can put in your personal information. I know they have this for children visits, where you can put in your different information, whether you're a woman, your age, any chronic conditions you have, concerns you have, and it kind of spits out a dialogue to have with your doctor, so that when you go in, you're making the most of your visit. And we have information on here about making the most of your visit. But one thing that we've seen is missing in the field is this toolkit to help ease this conversation, help men and women while they're in with the doctor, to know what to ask, what to tell their doctor proactively. Again, the clinical work group's working on the healthcare professional side, to get the clinicians to be proactively asking these questions to consumers. But really, this information also has what to do after, what to do, if you have a new diagnosis. Under the knowledge section, there's, a whole section on chronic conditions, on your ovulation. Of course, we had to have Zika on there. That's very important. Joining the lab, this is the section on how can you get involved, whether it's following us, volunteering, partnering with Share Your Love, applying to be a member, submitting a personal story, contributing to the national newsletter. Really, we're hoping that this will kind of be built out more, especially as we launch our Share Your Love Ambassador program, so that this page especially can become a platform to build a community of these healthy advocates, going into their communities, being role models of good health, the importance of practicing healthy behaviors now, and maybe even some struggles that they've had, maybe not all positive, just struggles that you've had to overcome to become healthy, to have this be really an engaging platform. You can go to who we are. You can see who our partners are nationally, how we're doing it. I walked you through our diversifying projects, the diversifying grants, how what we're doing to activate consumers. Again, I said it's really important that there's a click-through to healthcare professionals and policymakers. So there's an entire section on before and beyond. The press, so again, when PCHHC is in the news. And then showing the love, again, asking them to join the movement. This is all about the social media campaign. The social, any marketing that we have would go here. These, again, you hover over, and it's hoping to help people with drafted posts about how to get involved. So I show my love today by working every day to become a little bit healthier, happier version of myself with the hashtag Show Your Love Today. You can click the Facebook post or the Twitter. It'll auto-populate. You can add your photo. And it's just hoping to, easily get people involved. Again, here's, kind of a look of who is showing the love. We would like to have videos in this section as well, some testimonials about practicing good health behaviors. And with each of these images, I think it'd be great to have a quote from these people about living a healthy lifestyle and the importance of preconception health, and maybe struggles they've had with their well visit or questions that they have, to have a section for that to kind of comment back and forth. And then the contact us section, of course, you can always, especially on this call, contact me if you have any questions. I'm going to flip real quick back to the slides momentarily. All right. If you have any feedback from the slides, go ahead and either I'll have my email and putting it in the chat box as we speak, or you can add it in the chat box. Anything you noticed about, you saw, or you're fishing around and you see maybe a resource that's missing, an organization that we should reach out to. Any feedback you have, we're gearing up to launch, so it would be great to hear from you about your thoughts on it, about the images, the messages, how it can be built out a little more, to be even more engaging. So the next objective is, of course, so that website we just walked through, it's very social media heavy. How do we kind of link in all that we're doing on the website with all of this information, the knowledge section, the well visit section? How do we loop it into our social media campaign and making it something fun to do online? So we're launching the Show Your Love Today campaign on Twitter. It's on Facebook, and we have a LinkedIn showcase page. But we'd like to eventually, as we're working with these diversification grantees, we'd like to have a Pinterest page and Instagram page once we have more robust multimedia. Again, we have to develop messages for a variety of audiences. So, a variety of different hashtags, variety of different things that we should be talking about. And here's just a few. These are, if you go to the showyourlovetoday.com hashtag stream, you can see, what we've done so far. Again, this hasn't launched officially yet, so we're hoping to build even more engagement on social media. I'm going to turn this to you. Everyone on the call right now, open up your phones and open your Twitter app, your Facebook app, and go ahead and follow us and like us. Take a look at what we've posted so far. Look at the Show Your Love Today hashtag stream and engage with us. Another call to action for everyone on the call right now, share with us how you will show your love today. So either you can post directly and tag Show Your Love or PCHHC, or if you'd rather, say you're not on Twitter or you're not on Facebook or you're just more comfortable sending me an email with a quote, I can go ahead and post it on your behalf. I will ask if you do send it to my email, if you are able to take a selfie with a quote about the importance of being healthy. I'd love to put it on our website to feature your quote and your if you have a Twitter handle to help stir up some of the engagement. Another tactic we had is to lead and join tweet chats. So partnering with key influencers to really stir up conversation, especially with consumers. So around different national awareness days, and even going in, so Wellness Wednesday, National Women's Health Week, Men's Health Week. We actually have one coming up in about 2 weeks, and we're the one that's actually organizing it. It's the PCH chat, June 16th, it's 1 to 2 p.m. So I really encourage you to join in. It's our first. We've partnered with March of Dimes, Moms Rising, the National Campaign to Prevent Teen and Unplanned Pregnancy, and they are also tweeting along with Bedsider and StayTeen.org. Healthy Teen Network, Jay Cardiello, he is a celebrity men's health expert. He's on About.com. He's a hoot to talk to. Anna Almondrea, she's a health reporter at Huffington Post, and Dr. Pari Gadoshi, again, another celebrity OBGYN. And then we also have a lot of content contributors from USC Fertility, for example, is contributing a lot of content to really help bring awareness, raise awareness of the importance of preconception health. It's not, we're really focusing on how we frame health, men's health versus women's health in this tweet chat. If you'd like to join, or if you're part of an organization that's interested in becoming a panelist, feel free to email me. I can even send you the drafted script and the overview of the tweet chat that we have coming up for your feedback or for you to get involved. Of course, monitoring real-time conversations, so popular hashtags, handles, accounts, sparking discussions. I think really when you're doing a consumer campaign is to listen to the consumers. The great thing about social media is that we can see where the conversations are happening, where there's gaps, where resources are needed, where there's a lot of misinformation. So we're able to really listen to the consumers and to spark conversations with them. If we see a post that that we have a resource that we can help them with, we can link them to, that we're able to do so, that we're able to monitor and share trending news, whether it's just fun infographics, listicles, some fun news or more clinical heavy. To participate in other relevant tweet chats, Motivation Monday, the Lean In Together campaign, Throwback Thursday, things like that, and that we're virtually joining relevant conferences and summits, so that whether maybe we're not able to join a conference, we're not able to get to Blog Her or She Knows or a fun conference that's coming up that we know, perhaps a lot of consumers may be following. Social Media Week is another one. That we're able to monitor and still join those conversations. So building this online community, that we have a platform for community building and sharing, that everything's easy to share, it's one click. Joining the movement is, we kind of hand it to them, so it's pretty easy. Another thing is recruiting these Show Your Love brand ambassadors. Thank you so much for joining the call. I know this is where you're getting, so this is what you're hoping to hear more details on, about modeling and promoting healthy behaviors and life choices online and in your communities, raising awareness of optimal, practical and personalized health information. So that was the one thing that we kept wanting to focus our website on, is practical information and really personalized resources. So beyond just saying, take folic acid, here's how you can get it, beyond saying make sure that you're using contraception, you're using birth control, that we're linking to, here are clinics you can get it, here's a way that you can access it. So it's a lot more practical. So we're facilitating conversations with each other and those in our communities, whether it's online or in person. We're hoping to kind of gather these face of the brand spokespeople that can really get into these communities, help us as we're on social media looking in these conversations, that they can help us encourage these conversations and help raise awareness. Again, I went over the importance of virtual networking on social media platforms, whether it's going, at conferences that maybe we're able to attend or not able to attend, whether it's with media or, politicians. They're able to track, all of the different events, and they're able to promote online as well. That's another thing I was going to note, that that with the Show Your Love Ambassador Program, if you do send me a quote in a video or your image, I'm happy to promote your post. So we do have funds that we can put money behind a lot of this social marketing campaign. We're hoping to build this shareable content to distribute Show Your Love branded materials across different social media channels. So, working with our brand ambassadors and working with the diversification grantees, that we're able to have really robust content that reaches all different types of audiences, that we're promoting around larger milestones, that everything, we're constantly refreshing our content, our videos, our posts, our PSAs, and that we're able to hopefully create fun, some fun infographics, listicles, BuzzFeed type articles that are really easy, fun for consumers and easy to share. The Show Your Love Brand Ambassador Program. So you'll see on the left, an image of some different consumers that are, in front of our step and repeat. When we go to different conferences, we make sure we always put up our step and repeat to get some, some photos. One thing I want to note is that we do always need, for any marketing or social media that we use, we always use a photo release form so that they know that, for example, on this webinar, their faces will appear. And then part of the ambassador program is getting some Show Your Love swag, getting some branded materials that you can use to take, of course we'd love it in your video, and to wear that shirt or your hat in the video or in the photo, but just as a thank you for for partnering with us. So the ambassador program, what is it? As part of the social media campaign, we're recruiting young adults ages 18 to 29 to help us model and promote healthy behaviors and life choices online and in their communities. Ambassadors are asked to share their health journey on their personal social media channels, of course always tagging Show Your Love so that we know, when it goes live. We're able to, again, retweet it, promote it, put money behind it if need be. So whether it's posts, pictures, videos, quotes, that it'll go across all of our Show Your Love social media channels, our website, our newsletter, that we're able to, when we start gathering all these photos and videos and quotes, that we're able to use it for different materials for our partners as well. There's no time commitment to be a Show Your Love brand ambassador, and there's no really required social media following. We're just hoping that we'll offer you, some different Show Your Love branded items, and we're hoping that you'll really help us engage. I know in the PPE, the PPE program really focused on reaching these different communities, so this is just another way that we're hoping to leverage the work you're already doing. Why be a brand ambassador? The opportunity to share your personal journey, feats, your learnings, your hardships even. What have you struggled with and how have you overcome it? To connect with young adults online and exemplify healthy preconception health behaviors, to spark conversations and behavior change, to really raise awareness of the importance of it. You'll get free branded items. That's always fun. The opportunity to be featured nationally beyond just Show Your Love website. And again, I said all different marketing materials. PCHHC has the national newsletter and national partners that we're always happy. They always are asking for content and for connections. So you'll be virtually connected with some of the brightest minds in the industry and preconception field, as well as just different organizations that are working on the same, have the same work and the same missions to reach these consumers. And again, there's no real time commitment or required social media following, but again, just that ambassadors would need to sign a photo release form so that it can go on all of our different materials. You need to have your profile be public so that obviously if you're sharing something on Twitter, it can't be a protected tweet where no one can see it. And for our ambassadors, especially for the PPEs, to kind of share your health story, your health journey. Why do you care? Why are you so involved? Why is this important to you? And to you have the option to regularly contribute. So if we end up working with someone that just has an interesting story, or they just have so much to share, to regularly contribute via blog on our Show Your Love website, a vlog, whether it's kind of an ongoing, every week they want to submit a video log of their health journey. You'll get newsletter featured. We'll ask you to be maybe a moderator of a tweet chat or a social media takeover, where you would take on Show Your Love's Facebook and Twitter handle, and kind of for a day or for a week share your journey right through our national channel. So if you're interested in getting involved, I know that I went through that pretty quickly, but just for the sake of time, if you have any other questions about Show Your Love Ambassador Program, about working with PCHHC, about the launch, about some of our strategies for engaging with consumers, feel free to email me at suzannew@med.unc.edu. I have, there's so many other ways that we can partner, and so, I'm happy to connect offline, just with more detail about everything that we've went through really quickly today. Thank you so much for joining the webinar. I hope it was useful to you. If you have any follow-up questions, again, feel free to email me. I'll probably reach out with an email asking for if anyone's interested in becoming a Show Your Love brand ambassador. To kind of call for volunteers. It'd be really helpful, in our shared mission to advance preconception health in U.S. communities and online. All right, thank you so much.
All right, thank you, Sarah and Suzanne.
Yeah.
So we have a few questions from the crowd. The one that had come in for the email you actually answered, which is whether educational materials will be made available. And I believe the answer to that is yes. Someone also asked if you plan to have materials and tools geared specifically towards the Medicaid population.
So we do. That's something that we're not creating ourselves. We won't be creating our own resources, but we're hoping that, that as we're working with different organizations, whether it's, funding opportunities or just making different connections, that we're able to find resources that we're able to link to for Medicaid navigating this system. Does that answer the question?
All right. So we also have a question regarding more of a comment question regarding how the campaign plans to address the challenges of planning and preparing for a pregnancy once you find yourself, you've just found that you are pregnant. So you're not planning to.
That's a really interesting question. I just had this conversation with someone yesterday about you know, and we're going to address this in our tweet chat as well about finding out you're pregnant and what do you do now. And one thing especially that we're going to talk about in our tweet chat is for the man and the woman, the different roles of that. So, you know, whether you were dating before and you were in a safe relationship or you weren't, how that can be a pressure on the relationship, how to navigate it, what resources are available to help you, you know, make good choices for, you know, once you're faced in that situation. So that definitely is something we will address.
Okay. And the last question was whether the campaign will address LGBT or trans health and, you know, that aspect of pregnancy in the future as well.
We currently are partnered with an organization, and that's their main focus. They work solely in LGBTQ, and they've really been, you know, a key partner with us in addressing that. There's been a few other organizations, but they've really taken the lead on taking an eye to all of our messages, all of our resources, and opening it up to and our images to LGBTQ populations as well.
And this will be, will it be presented in the website as well? Because the concern came up with people were seeing the website where it says men, women, and they were wondering if in future the website would also include like a little card or a little portal for are you LGBTQ, and that's where you would go.
So on the website, I think that, you know, what we'd like to do is to keep the audience a little more general, but yes, it would be more specific. So at any time we're referring to men or women, it would say young adults. Obviously, for like the wellness visits, it does need to be separated. But I think that it would be interesting down the road to have a separate section, yes, for you know, are you LGBTQ, and have your own set of resources and your own you know, different modules, different toolkits, you know.
All right. And a question just came in about whether there will be an information flyer that can be handed out in order if people are giving consumer presentations about becoming an ambassador.
Oh yeah. After this call, I'm happy to share. We have flyers. We have different materials. All they need to do is really email me. I have 3 questions I'll ask about, you know, about wanting to join the ambassador program, and then from there, you know, we really work on how they want to partner. Because the good thing is, since there is no time commitment or really required following, that, you know, the ball is kind of in their court. You know, if you want to be really involved in the Show Your Love Ambassador program, you can be. If you just want, you know, a one-time feature, you can do that as well. And I definitely have materials about that that I'm happy to share.
All right, so we have about 5 minutes left. Does anyone have any further questions at this point? Everyone's muted, so people can't quite answer. So if no one has any further questions at this time, then I wish to thank our speakers, Sarah and Suzanne, once again. And on behalf of Teddy Owusu and everyone here at OMHRC, I would like to thank you all for taking part, for taking the time to attend our webinar today. And I'm really hoping everyone will have a very restful Memorial Day weekend.
All right.
All right.
Thanks so much,
thank you, everyone.
Look forward to hearing from everyone.
And good night.
All right. Have a great weekend.